Human upper limb is a marvel of evolutionary adaptation, containing a total of 64 bones, 32 on each side. These bones work together to provide a wide range of motion and dexterity, allowing us to perform everything from delicate tasks like writing to powerful actions like lifting. The upper limb bones include the clavicle, scapula, humerus, radius, and ulna, among others. Understanding their structure and attachments is essential before delving into dissection or advanced study. The evolution of the upper limb has enabled humans to grasp, feel, and manipulate objects with remarkable precision. This transformation from the pectoral fins of fishes to the versatile limbs we have today highlights the importance of joints, the addition of the clavicle, and the unique mobility of the thumb. As we explore each bone, keep in mind how their features support both movement and stability. Let's begin with the clavicle, often called the collarbone. This slender, S-shaped bone acts as a strut, supporting the shoulder and transmitting the weight of the upper limb to the trunk. Unique among long bones, the clavicle lies horizontally and is subcutaneous throughout its length. It is the first bone to start ossifying and has no medullary cavity. Clavicle shaft is divided into a flattened lateral 1/3 and a rounded medial 2/3, each with distinct surfaces and attachment points for muscles and ligaments. Moving to the scapula or shoulder blade, we find a thin, flat bone positioned on the back of the thoracic cage. The scapula features 2 surfaces, 3 borders, 3 angles, and 3 processes, including the prominent spine and acromion. These structures provide attachment for numerous muscles, enabling the wide range of motion at the shoulder. Together, the clavicle and scapula form the shoulder girdle, a foundation for upper limb movement. Humerus is the longest bone of the upper limb, forming the skeleton of the arm. Its upper end features a rounded head that articulates with the glenoid cavity of the scapula, creating the shoulder joint. Shaft of the humerus is rounded above and triangular below, with distinct borders and surfaces for muscle attachments. Notable landmarks include the greater and lesser tubercles, the intertubercular sulcus, and the deltoid tuberosity. The lower end, the humerus, expands to form the condyle, which includes the capitulum and trochlea for articulation with the radius and ulna. The medial and lateral epicondyles serve as origins for forearm muscles. Clinically, the humerus is prone to fractures at the cervical neck, shaft, and supracondylar region, each with specific risks to nearby nerves and blood vessels. Understanding these features is crucial for both anatomical study and clinical practice. Radius is the lateral bone of the forearm, homologous with the tibia in the lower limb. It has a disc-shaped head at the upper end, which articulates with the capitulum of the humerus and the radial notch of the ulna, allowing for the rotation of the forearm. The shaft of the radius is characterized by 3 borders and 3 surfaces, providing attachment points for muscles and the interosseous membrane. Lower end of the radius is broad and features the styloid process, as well as grooves for extensor tendons. Clinically, the radius is important for wrist movement and is a common site for fractures, especially near the wrist and falls. Understanding the anatomical features of the radius, including its articulations and muscle attachments, is essential for appreciating forearm and wrist function.